Are you experiencing lower abdominal pain, burning while passing the urine, and you have frequent trips to bathroom? Well, this might well be the symptoms. Seemingly normal things might be the symptoms of urinary tract infection. Most of the people think that UTIs are very, very common and they'll go away on their own. But do you know, if urinary tract infection is left untreated, it might well end up in you in a soup. You might end up with severe complications with kidney infections. Hi, I am Dr. Rajat. Today in this video, I'll tell you everything what science has to say about urinary tract infection. What are UTIs? What are the risk factors of urinary tract infection? What causes an urinary tract infection? What are the symptoms of urinary tract infection? What is the medical recommendation for urinary tract infection? How to prevent urinary tract infection at home? By the end of this video, I promise you will know how to recognize a urinary tract infection at home, when to visit a doctor for a urinary tract infection, what to do to prevent the urinary tract infection at home. Watch the video till the end, because most of the people who have recurrent urinary tract infection would like to know a tip from me. Hello, I am Dr. Rajat and you started watching our YouTube channel, Fertility Gynecologist. Everybody knows what UTI is, because most of the people come and tell me, most of the females come and tell me in my OPD, sir, I am having UTI. So what are the signs and symptoms of urinary tract infection? Like I mentioned in the intro of my video, first symptom is burning micturition. Whenever you pass the urine, either at the beginning or during the process of passage of urine or at the end of there is a sensation of burning, jalan hoti hai. This is the first symptom. Because of that, most of the people fear passing the urine. The second symptom is lower abdominal pain. It can be a pelvic pain, and this is due to the cystitis, that is the inflammation of bladder. And there is an frequency of urine. There is an urgency to pass the urine. Most of the people would have complained, I have to go to pass to the loo to pass the urine, but the urine does not come. So these are the main common symptoms, and if the urinary tract infection becomes severe, it may also cause fever. These are the most common symptoms and signs of a urinary tract infection. The second most common thing which people ask me in my OPD, how to get rid of urinary tract infection without the use of antibiotic. What an analogy I use, think your urinary system like a flush. The more you flush, the more whatever the waste is collected gets away. So you have to hydrate more and more. Every human being should take at least 3 to 3.5 liters of fluids per day, because our insensible loss, what we inspire and what we exhale, that is basically a water vapor, and that loss is about 1200 ml per day. Apart from that, whatever we pass in urine, on top of that our intake has to be 500 ml more than what we lose. And in a hot and humid country like India, we Indians tend to perspire. That is why our liquid intake should be approximately 3.5 liters per day, which unfortunately most of the female, especially those females who are working, they do not take. Why I took the name of working females? Because unfortunately in India, the public toilets, the common toilets are not very hygienically clean, and most of the females have a fear, or which is most of the times real, they get infection while using the public bathrooms, and that is why they tend not to drink water, so that they don't have to pass the urine, and as a result it aggravates. This cycle keeps on continuing. So the first and the most important thing to prevent a urinary tract infection is to hydrate yourself. The question comes, how to keep yourself hydrated? You can have water, you can have lime water, you can have juice, you can have soups, you can have coconut water, you can have buttermilk, you can have milk, you can have coffee and tea in moderation, because they are dehydrating substances, but a couple of coffees a day or couple of teas a day won't do much harm, but that should not be in excess. What should not be taken though is alcohol as a liquid. You should not even take fruit juices, you should not even take the colas or the sodas for the liquid purpose. You can have soups, you can have dals, everything, but you should keep yourself hydrated. That is the first and most important part. Second important part is to keep passing urine every 2 hours. What I tell my patients is, drink by clock and empty your bladder by clock. Drink 1 glass every hour and go to loo every 2 hours to pass the urine, because urine is a very, very good culture medium for the bacterial growth, and if the urine is stagnated, the bacterial growth would start occurring. Now, problem with how to measure that you are drinking 3.5 liters of liquid per day. Almost majority of us drink water through in a glass. Glass is sometimes 150 ml, sometimes 200 ml. They say we drink about 10 glasses a day or 12 glasses a day or 20 glasses a day, whatever. But problem is, suppose that glass, the capacity of that glass is 150 ml, but that 150 ml is still the brim. Most of us, 99.9% of the people won't be filling the water up to the brim. That is one thing. And not almost always we drink the full glass of water. Sometimes we may drink couple of sips, or we may drink half glass of water, or we may drink quarter glass of water. So we human beings have a tendency to overestimate the amount of water we drink. So I firmly believe that if you want to measure your liquid intake, it should be in a bottle, either a 500 ml bottle or a 1 liter bottle, and you should be, because in bottle whatever amount you will drink, the rest will be there inside, and that bottle should be taken only by the person concerned. So suppose you are drinking three bottles of 1 liter each. Top that up with frequent servings of lime water or buttermilk, and I would not ask you to add sugar in your lime water. Plain lime water or green tea or green coffee or buttermilk or soup or dal. So this should be your things to hydrate yourself. Most important question: why do women get more urinary tract infection than men? Male urethra is about 10 to 14 centimeter long, and female urethra is only 4 centimeter long. Only 4 centimeter long. And like I mentioned in my previous videos, vagina has got many commensal organisms. There are bacteria in there. There are different species, and those bacteria, they can very well cause urinary tract infection. And because the urethra is 4 centimeter long, is just above the vagina. So during sexual intercourse also that urethra gets rubbed, and that is why most of the females complain of urinary tract infection after the history of sexual intercourse. And that is precisely the reason that while most of the newly married females come up with the complaint of burning, micturition, lower abdominal pain, which we in our medical jargon called as honeymoon cystitis, that is basically not a typical urinary tract infection. That is the irritation and the caused by the friction of intercourse, because bladder and urethra are just above the vaginal wall. So that is why females have got, anatomically they are predisposed to urinary tract infection. And like I mentioned, the working females, because they have got a taboo, a fear of not emptying the bladder in public urinals or public toilets, that is why they get more urinary infection. Most commonly asked question is, can you get the sexual UTI from sexual intercourse, and how to prevent it? I answered this question in my previous thing. Yes, a female can definitely get a urinary tract infection from a sexual intercourse, and prevention is, there are two things: A, her sexual partner, the male, should not have a pelvic inflammatory disease, and B, uses of a barrier contraception like a condom goes a long way in preventing the urinary tract infection from a sexual intercourse. Also, a good lubrication before the sexual intercourse, it prevents the friction, which in most of the cases causes a urinary tract infection. Some females are getting recurrent urinary tract infection. What are the causes of recurrent tract infection? Most common cause of a recurrent tract infection is your inability or your non-willingness to drink more water. So most of the females are dehydrated, and as a result they get more urinary tract infection. Also, the non-willingness or circumstantial problems to not pass frequent urine. This is the most common cause of a recurrent urinary tract infection. Apart from that, an untreated male partner, after the if they have a sexual intercourse, that can also lead to a urinary tract infection. And the medical condition which commonly predisposes to urinary tract infection is a diabetes or any condition which lowers the immunity, like HIV, patient is on steroid use. These are the most commonest condition. So the most common way to prevent a recurrent urinary tract infection is to keep yourself hydrated properly. Again, I would reiterate: plain drinking water, plain lime water without sugar, buttermilk, milk, couple of cups of tea or coffee, green tea, soups, liquid dals, anything which is liquid would work wonders. What you need to avoid is sweet drinks, colas, fruit juices, ruh afzas, sharbats, and all those kind of mocktails, and of course alcohol you should avoid. Now, a couple of days back, a female came to me with history of hematuria, that means blood in urine. So does blood in urine signify something? Blood in urine signifies, yes, there might be infection. It also signifies that there might be a kidney stone or a stone in urinary tract. That also leads to the incidence of urinary tract infection. So whenever there is a blood in urine, the first thing you do is to treat the urinary tract infection, and then go for a investigation like an ultrasound to rule out the kidney stones. And in worst cases, there might be a malignancy or a cancer of urinary tract. But believe me, I always tell in my videos, I was always told that only dogs are found on the street, not elephants are found on the street. So you have to think for the common things first. we do not think about cancer first. We always think about the infection and the renal stone first. So blood in urine in a young female mostly signifies either a urinary tract infection, a kidney stone, or a post-intercourse bleeding. Now, one of the very common things which around females around 40 post menopause come to us with constant complaint of burning micturition. All the investigations are normal, the urine report is normal, the urine culture sensitivity is normal, the urine, even the ultrasound is normal. Basically what happens is, as the female grows older, as the menopause approaches, or in menopause, the estrogen hormone in body has decreased and is very, very less. And estrogen is the hormone which is important for the rugosity, which is important for the moisture and the hydration of the vaginal mucosa. What happens in post-menopausal or the menopausal females is there is a dryness of the vaginal mucosa and the rugosity is lost, and that is why there is a constant irritation, especially while passing the urine. No amount of antibiotics in the world can cure that thing, and most of the doctors, especially non-gynec doctors, have a tendency to keep on giving antibiotic after antibiotic to those kind of females, which unfortunately does not work. In those cases, a simple application of a estradiol cream in the vagina, especially in the upper 2/3 of vagina, which is an estrogen receptor sensitive area, it works wonders. How to use an estrogen cream? For how long to use an estrogen cream, that we have discussed in our menopausal video. We'll make a separate video on that also. Is it safe to treat the UTI in pregnancy? UTI is very, 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 very common in pregnancy. I always mention pregnancy is an immunocompromised condition, and pregnant females are mostly prone to infections. The most common is a respiratory tract infection, throat infection, gastrointestinal infection, vaginal, and the urinary tract infection. And the pregnancy itself causes the changes, the pressure on the urinary system, the bladder, the urethra, the ureters. So it is prone to a urinary tract infection. So yes, again, there should be more hydration, and it is very safe to treat the urinary tract infection in the pregnancy. On the contrary, you should be hyper aggressive in treating the urinary tract infection in pregnancy, because any infection would lead to a release in the cytokines. These cytokines may well precipitate the preterm labor, and infection followed by inflammation is one of the most commonest causes of a preterm labor in pregnancy, and that is why you should be very, very aggressive, and your threshold should be very low to treat the urinary tract infection. However, the types of antibiotics we use in a female who is pregnant versus a female who is non-pregnant, it differs drastically. We use only cephalosporin groups of antibiotics in females who are pregnant. We cannot use the gatequins, the norfloxacins, and the ofloxacins group of antibiotics in females who are pregnant. This is very, very important. This I'll discuss later on in the video, which antibiotics to use. Can UTI be dangerous? In most of the cases, UTI is not dangerous. The symptoms are pretty much common, and most of the symptoms, they go away within 7 to 10 days with a proper treatment, proper hydration. But if it is recurrent, if it is left untreated, then this infection can go from urethra to urinary bladder to ureter to the kidney, and it can lead to a condition called as a pyelonephritis. That means the infection of the kidney and the renal pelvis, which can cause high-grade fever, which can land a patient in an ICU. Long hospitalization may occur, and if these episodes of renal infection are quite frequent, then even in worst possible cases, the renal failure or kidney failure may also occur. So the all effort should be made to prevent the infection up to kidney, and these are perfectly preventable because it is an ascending infection. It is not an infection which arises in the blood. It is an ascending infection, and at the moment you can arrest the spread of infection from urethra to urinary bladder to ureter to kidney, everything can be taken care of. Only thing is, if there is a renal stone, then you cannot prevent the ascending infection. Then you have to aggressively manage the renal stone either with hydrotherapy or with a laser destruction of the renal stone. How long does the treatment of UTI last? This is where the controversy comes. Most of the general practitioners, some physicians, they treat urinary tract infection for a couple of days, 3 days, patient is symptomatically fine, and they stop the treatment. I am of the opinion that minimum course of an antibiotic for a urinary tract infection is minimum 5 days, preferably 7 days, and in cases who have got recurrent infection, it can be also treated up to 14 and 21 days. So these were the most commonest questions which most people ask to me in my OPD. Now let us go into the details. I mentioned about the symptoms. I mentioned about the preventive aspect. If a patient with pregnancy comes to me with complaint of burning micturition, lower abdominal pain, what I would like to do is, in a theoretical world, I would first of all like to get her urine routine microexamination done. Look for the presence of pus cells. The presence of pus cells from 1 to 5 cells per high power field is normal, and anything more than 10 pus cells for high power field, it should be treated. We normally treat with the cephalosporin group of antibiotics. If cephalosporin group of antibiotics has already been taken, patient is not getting any benefit, we can switch over to a phosphomycin group of antibiotics. A plain sachet can be taken in single dose, it can be taken in multiple doses also. The problem with phosphomycin sachet, what I have experienced is it is a very powerful group of antibiotic, and few patients do land up in nausea, vomiting, diarrhea, all those kind of things. So I always give this phosphomycin along with a probiotic. We can also use cranberry extracts. The syrups are available, the sachets are available, the tablets are available. Cranberry, what it does is it attaches itself to the urothelium and prevents the attachment of the bacteria to the urothelium, and that is why it prevents the recurrence of infection. Symptomatic management can be done by the urinary alkalizers. Lots of urinary alkalizers are available in the market. They basically change the pH of the urine from acidic to the basic, and the moment the acidic urine is not passing through the urinary epithelium of the urethral mucosa, the burning maturation goes. And what I tell my patients in an emergency, the moment a emergency call comes to me, I immediately tell the patient to take a soda, Eno. Yes, you heard it right, Eno soda. What it does is it immediately makes the pH of the blood slightly basic. That blood, when it goes to the urine would be slightly basic compared to the acidic, and the patient would get an instant relief of the pain. However, that should be taken only under the guidance of doctors in terms of an extreme emergency, either at night or on holidays when the doctor is not available. But that works wonders for me. Yes, urinary alkalizers, but what most of the people do, once doctor has prescribed the urinary alkalizer, they keep taking directly urinary alkalizer. While urinary alkalizer may just give a symptomatic relief, it may not treat the underlying cause of infection, and which can be only done by antibiotics. So that comes to my next very important topic, which are the antibiotics. I have already mentioned in pregnancy we'll give cephalosporin groups of antibiotic, we'll give phosphomycin group of antibiotics, but if the patient is and we can also give nitrofurantoin group of antibiotics in pregnancy. Nitrofurantoin group of antibiotics are extremely safe, extremely effective. Unfortunately, not many people give nowadays, but you just have to take one care that you have to rule out the G6PD deficiency, because nitrofurantoin group of antibiotics should not be given in females who are G6PD deficient. And one thing you have to advise the patient that when you are taking a nitrofurantoin group of antibiotic, your urine would be orange to reddish color, light red to orange color, and please do not worry about that thing. A non-pregnant female comes to us with same complaints, lower abdominal pain, burning maturation, increased frequency of maturation. Apart from hydration, we give norfloxacin. I personally, this is my favorite antibiotic, norfloxacin 400 mg given twice daily for 7 days. It works in almost every patient. Believe me, I do not exaggerate, and I haven't used anything other than norfloxacin to my urinary tract infection patients in last 15 to 17 years. This works wonders. We can give other antibiotics also, but I personally do not believe in giving anything other than norfloxacin. People give ofloxacin, people give gatifloxacin, people give all those kind of things, people give other antibiotics, but for me, norfloxacin works wonders. If patient has already taken norfloxacin, I add or I put the patient on nitrofurantoin. Beyond that, I have not required to do anything. If patient is having a recurrent urinary tract infection in spite of adequate hydration, we recommend urine culture sensitivity. Rather than giving patients empirical antibiotic, it is better to go for a culture sensitivity. We take the urine sample, send it to laboratory. In laboratory, they test that urine, which antibiotic works well against the infection, and whatever antibiotic the CSR report, the culture sensitivity report comes, and that says, suppose that report says this patient is sensitive to cefixime, then we give cefixime. That report says the patient is sensitive to augmentin, we give augmentin. Basically, whatever the antibiotic is sensitive to that urine should be given, but that course should be taken completely. Unfortunately, in India, what happens is, because these antibiotics are so powerful, and the effect of antibiotics starts appearing after 48 hours, and in within 72 hours, almost 90% patients have got symptomatic relief. So patients, either because of the financial conditions or because of their over smartness, many patients, they stop taking antibiotics after 3 days. कि सर हमको अच्छा हो गया, अब हमको जरूरत नहीं है. Unfortunately, we are doctor. If we have prescribed 10 tablets or 14 tablets, that is for a reason, because yes, while the effect of antibiotic, the moment you start taking the first tablet of antibiotic, that antibiotic effect starts appearing, and within 48 hours 50% effect has occurred, and within 72 hours almost 70 to 90% effect has occurred. But for complete effect, you need to take the complete course. This is very, very important. By not taking the complete course, you are doing harm to yourself, because not only you, your body may become resistant to that antibiotic. So next time you have a urinary infection, that antibiotic may not act on you. Also, Next time you have an infection, it will be of a more severe degree because bacteria and viruses have a innate tendency to become mutant, and they become mutant, they become resistant to a incomplete, not proper dose, not proper duration of a antibiotic treatment. So whatever dose your doctor has given, for whatever duration your doctor has given, request please complete the course of antibiotic. There are few co-prescriptions along with the antibiotics. I've discussed just these three because I use these three. Pre and probiotics are very important part of my prescription in an UTI, especially to prevent the further UTI. I always say prebiotics are like Indian Army and infection is like enemy army. If there is a good amount of prebiotic in the mucosa, all the mucosas which are open to the outside world, the nasal mucosa, the oral mucosa, the GI mucosa, the respiratory mucosa, and in females the urinary tract mucosa and the vaginal mucosa, these mucosas can get infected very easily, and these probiotics, they act like a defense to prevent the invading organisms, and that is why a good and a liberal course of prebiotics and probiotics should be used for at least 3 to 4 months, and not the same brand of probiotics. Ideally, theoretically, they say the probiotics have to be rotated in strains. While strains means there are different species of probiotics, the lactobacillus, the rhamno, the bifidobacterium, all these things. Ideally, you need to rotate the strains, but because we are not manufacturing these strains by ourselves, it is better. What I simply do is I will switch the brands. 7 to 10 days you take a particular brand, 10 to 15 days you take another particular brand, have a 1 week break, then have another brand. So by this way, the strains of the lactobacillus, the probiotics are changed, the strains are changed, and that gives a good immunity to prevent the further amount of infection. Suppose patient has already visited a couple of doctors, they have already given this nitrofurantoin, norfloxacin, ofloxacin, cefixime, fosfomycin, still patient is not getting the relief. What would I do? Or in other words, what are the indications in which the patient has to be given an injectable or an IV antibiotics? There are two indications. A, patient is having a high grade fever, patient's general condition is not good, patient is not able to tolerate oral feeds. In those cases, what we do give is injectable antibiotics, and even in that injectable antibiotics, my first and foremost line of treatment is an injectable cephalosporin, third generation cephalosporin, that is ceftriaxone 2 gram. I give normally 12 hourly for 3 days injectable, and along with that I normally give patient a liter of saline, a ringer lactate, so that the hydration occurs. And almost every patient has got symptomatic relief within 48 to 72 hours. Problem with a urinary tract infection is, in our human body, the organs are not like segments. If an infection occurs in one particular organ, that may affect the other particular organ also. And in female, urinary bladder is anterior to the uterus and cervix. It is very near to the vagina. Posterior to the uterus there is a rectum and anal canal, and along the sides is fallopian tubes, ovaries and intestine. So basically, if the infection spreads, it spreads to other organs, and that we in our language call it as a pelvic inflammatory disease, PID. And that is why if there is a generalized abdominal pain, backache, low grade fever, difficulty in passing urine, white discharge, we consider it as PID, and we treat as a syndromic approach rather than as a single infection approach. We give bacterial antibiotic, we give a protozoal antibiotic also, we give a antifungal also in those cases. If patient is having white discharge, if patient is having itching per vagina, if patient is having a pain during intercourse, if there is a probe tenderness on ultrasound, then we give treatment for PID, and we also treat the sexual partner of the female also. Is there any role of an ultrasound in diagnosing of urinary tract infection? While the conventional wisdom would say that there is no role of doing an ultrasound, but when there is no infection found on urine routine micro, if we get an ultrasound done, there is the changes of cystitis, the urothelium inside the mucosa of the urinary bladder becomes thick, it becomes inflamed, and it suggests that cystitis means the infection of urinary bladder. We have to treat that infection, and there is a probe tenderness. The moment you put probe on the pubic area, suprapubic area, there is a tenderness, and sometimes if the urine is there, we can see the echogenic flakes in the urine, and that suggests to us that there is a urinary tract infection. And in my practice, I normally do not get a urine routine micro, because if I send sample for urine routine micro right now, I'll get the report couple of hours later. It is better to start an empirical treatment of antibiotic, and in most of the cases, females, they get relief by an empirical treatment of antibiotic. When to give oral antibiotic, when to give injectable antibiotic? Suppose the pus cells are about 10, 15, 20 30, it is, you can give an oral antibiotic, but if there are more than 100-150 pus cells, or there is a, along with the pus cells, there is a presence of blood in the urine, then in those cases you have to give an injectable antibiotic with proper hydration, that is IV fluids. There is no role of urinary catheterization in urinary tract infection, especially if the patient is able to walk, if patient is able to talk, if patient can move, then there is no role. On the contrary, the urinary tract infection would get worsened if you put a Foley's catheter, especially if it is not done in a proper aseptic manner. This was all about urinary tract infection. There are 4 key points which need to be taken care of. They say prevention. It is better to prevent and prepare rather than repent and repair. So prevent and prepare aspect means drink plenty of fluids. Keep yourself hydrated. Go to pass urine every 2 hours. Go every 2 to 3 hours. Do not hold the urine. And if you have lower abdominal pain, if you have burning micturition, visit to the doctor at your earliest. A burning micturition at night or an emergency, immediately take a Eno or a soda. You might have some 50, 60, 70% symptomatic relief. Immediately visit the doctor next day. Whatever course of antibiotic doctor has given, 5 days, 7 days, please complete it. There is no course of antibiotic which is only 3 days or 2 days, except for fosfomycin, which is a single dose therapy or a 2 or 3 dose therapy. And if your doctor says you need to get admitted for IV fluids and IV antibiotics, please trust the doctor, because if infection, it is not treated, it spreads, it might spread to the kidney and it might well become life-threatening. You might end up in ICU, and couple of more episodes of kidney infection, you might end up in losing your kidney. This was all about urinary tract infection. Keep watching our channel, keep subscribing to our channel, share your views, questions, even feedbacks. Please share the video. Please like the video. Thank you. Namaskar. Bye-bye.